This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is our Advocate in Action feature, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Allyson Ocean, Associate Professor of Medicine at the Weill Medical College of Cornell University and Medical Oncologist at the Jay Monahan Center for Gastrointestinal Health in New York City. Hello, Dr. Ocean.
Thank you for having me.
While there are many organizations out there that are research-focused, you really complement those organizations because you're psychosocial focused.
So much of treating cancer patients is obviously finding therapies to make them live longer and to conquer the cancer. But a real passion of mine is doing all that plus supporting the patient at the same time. The support that patients need while they're going through cancer is enormous. In many different cancer types, there are so many unmet needs in the supportive care realm. And that's what led myself and two other people who are the relatives of a young patient I took care of with colorectal cancer, Michael. We formed Michael's mission for that purpose exactly, to improve quality of life of patients going through treatment for colorectal cancer through education, through research, and through patient support. We kept hearing about all of these patients and their families saying, we don't know where to go next. We don't know what information to have. How do I know if this is going to help my side effect for nausea and vomiting? How do I deal with a colostomy? All these questions that are very common, important questions, but there wasn't a unified set of resources to deal with it. So our goal is to make that more available to the patients with colorectal cancer. Our most recent initiative, which is very, very exciting, is we are launching a patient care support program. We did an extensive look at what's out there in the field of supportive care, and there are very few supportive care programs where patients who are going through chemotherapy get access to an oncology social worker one-on-one while they're getting chemo, to talk about their unmet needs, to talk about any problems that they have, issues with reimbursements, issues with side effects, emotional issues, fears about dying, fears about relapse of their cancer, how to get access to clinical trials, how to get new drugs, etc. And so they're going to have this one-on-one access to a oncology psychosocial support worker to help them through their journey. We are a young organization, and while we would love to be able to fund millions of dollars of cancer research, we know we can have more of an impact one-on-one on the patient level through our supportive care programs that we're launching. That makes us feel good that we're doing something that we can actually see the benefits immediately for the patients, and that's really special.
Thank you, Dr. Ocean. Dr. Allyson Ocean, Associate Professor of Medicine at the Weill Medical College of Cornell University and Medical Oncologist at the Jay Monahan Center for Gastrointestinal Health in New York City.
Thank you.
Nice to see you again.
Nice to see you too.